Good morning, good afternoon, good evening, wherever you are in the world. I am Tamar Ghosh. I'm the Chief Executive of the Royal Society of Tropical Medicine and Hygiene, and I'm delighted to welcome you to the webinar on behalf of RSTMH team and our Board of Trustees on this very special day, World Neglected Tropical Diseases Day, affectionately known as World NTD Day. And so this webinar on climate change, malaria and neglected tropical diseases is delivered by RSTMH in collaboration with the World Health Organization Task Team on Climate Change, NTDs and Malaria. So I'm sure you all know World NTD Day is one of only 11 global health days which is recognized by WHO, which really reflects its importance to our area of work. It exists to raise the awareness and the profile of NTDs, which, as you know, are 21 diseases that still affect an estimated 1.5 billion people. Under the theme of Unite, Act and Eliminate, the day aims to increase support for the control, elimination and eradication of these diseases in line with the WHO NTD roadmap, which is from 2021 to 2030. So we're almost halfway through now. At RSTMH, we're really proud to be a part of this day. This webinar showcases a paper on climate change, malaria and NTDs, which was recently published in one of our scientific journals called Transactions. And we are so very grateful to WHO for choosing Transactions as the place to publish this really significant paper. Our scientific journals here at RSTMH are one of the ways we disseminate research, findings and opinions, and other recent supplements published within those journals on NTDs include Mental Health and Stigma and Trachoma. And actually today we're publishing a really huge special issue on snakebite. We're going to put the link to you at some point, so you'll be able to have a look at that. We're also currently working on a special issue collection on AI and global health. We'd be so interested in receiving submissions from you on the use of AI in NTDs, prevention, diagnosis, treatment, surveillance, and any other areas. Please do send them our way. We'd love to put them in the special collection, and that's across both of our journals. So for those of you that don't know us, RSTMH is a membership society for people working in tropical medicine or global health, and that includes NTDs, of course. It also includes NCDs and other areas of global health. And our members and fellows that we have are based in over 100 countries. We support them in lots of different ways. We provide them with grants and travel scholarships. We publish 2 scientific journals to raise their understanding of different areas of the topic. We deliver in-person and virtual meetings and events like today. We also establish platforms for them to have global networking opportunities and provide them with guidance and support. And we also finally give out medals and awards to recognise success in all stages of careers in our sector. So we do all of these things to try and enhance our member and our fellows' careers as much as we can, but also to support the wider tropical medicine community in achieving those big goals that we all are working towards: elimination, eradication, and improved equity to global health. So we use our global networks and our partnerships to help achieve change in policy, to highlight important findings, and also to plug research gaps that we identify. And we do this as a team of 9 people in the UK, supported by 1,000 volunteers across the world. And they are ambassadors, assessors, reviewers, our committees, and our board. And we couldn't achieve what we do without their support. You can go to our website to read more about our work. And most importantly, and if you have the time, please do sign up to our free newsletter. It contains lots of information about global health from across the world, but also everything that we're doing to try and support our members and fellows and others in our network. I wanted to say a big thank you before I hand over this to WHO for working with us to deliver this webinar. And now to the discussion itself. I'm really delighted to introduce the chair for this discussion, Dr. Samson Kiware, who is Principal Research Scientist at Ifakara Health Institute, Tanzania. Thank you so much, Sam. Over to you. Sam, just checking you can hear me. We're over to you to start your introduction.
Hi, Tamar, I can hear you. Can you hear me? Thank you, Samar. Can you hear me? right, thank you so much. I really appreciate that kind of introduction. Good morning, good afternoon, good evening. And just in case of any issues with internet connectivity, Tamara, I've asked you to help me co-chair the session. Again, I also want to welcome everyone on this exciting webinar. As you all know, climate change isn't just an environmental crisis, it's a major threat to global health. In particular, it's driving shifts in the spread, intensity, and emergence of infectious diseases. Today, we'd like to explore what we know about how rising temperatures, changing ecosystems, and extreme weather events are reshaping the landscape of malaria and neglected tropical diseases, and what this means for public health and policy. So to start with, I would like to invite Dr. Ebere Nkene Okereke, who is the Chief Program Officer, Reaching the Last Mile. Dr. Ebere is a global health physician whose work primarily focuses on health security, health system strengthening, and cultivation of effective leadership in the field. Over to you, Dr. Ebere.
Thank you very much. And so first of all, I'd like to thank the organizers, the Royal Society and the WHO team for inviting us to join this important conversation. It's my privilege to represent the Reaching the Last Mile, which is a philanthropic organization that supports access to healthcare for marginalized communities. A lot of our work focuses on neglected tropical diseases, and we support WHO strongly in the ambition to eliminate them by 2030. We're also interested in strengthening the health systems that ensure that these communities will cease to be neglected. So as a global funder, Reaching the Last Mile is acutely aware of the implications for that climate change have for these neglected diseases and the fact that they might actually start to, climate change is reversing some of the successes that we've had in this space. So we're quite honored to have the opportunity to sponsor the research that's going to be presented in this webinar, recognizing the importance of understanding the actual burden of disease, the implications of climate change for the diseases that have been mentioned, neglected diseases and malaria, and what changes that we need to make, both in terms of the programming itself and the funding, in order to continue the successes that we've seen so far. And it's important to mention that we do have some successes. And today, we heard earlier today the announcement that Niger has become the first country in the Africa region to declare itself free of onchocerciasis, river blindness. And the Reaching the Last Mile is honored that it has, through its Reaching the Last Mile Fund, Niger was one of the countries that it has supported to achieve this goal. The message is that it is possible. It's important that we understand the new and changing environments that we have to work in, so that we can course correct, adjust our programs, and ensure that there's adequate and correct use of the resources that we need for addressing the continuing challenge of neglected tropical diseases and malaria and other diseases that are susceptible to changes due to climate change. But to do that properly, we really need to understand the disease, the change in the epidemiology, what the impact of climate change has been. And we're very excited by the thorough research that will be presented in this webinar that describes what we know, what the gaps are, and therefore what the next steps should be. So on that point, I'll pass it back to the moderator, and I look forward to hearing from the team that conducted this excellent research for us. Thank you very much.
Thank you so much, Dr. Gair. I like that. So and just one thing I want to point out, if you have questions, please use the Q&A function. And also, you can be reading the full bio if you want that to be posted on the chat. So next, I would like to invite Dr. Petra Klepak, who is she's the Global Health Modeling Consultant at the World Health Organization. Dr. Petra is a mathematical ecologist working on transmission dynamics and control of infectious diseases, with a particular interest in international cooperation in global health. So she'll be describing the methodology of the review. Over to you, Dr. Petra.
Thank you very much for introduction, and thank you everybody for this lovely webinar. And it's great to see such a big audience. If I could ask for the slides to start, please. And while we're waiting for the slides, as Ibrahima mentioned, climate change really affects the distribution and impact of NTDs, and it's a very fast developing field. So really this review was intended to summarize the latest scientific evidence, as well as identify gaps and opportunities in data, knowledge, methodology, surveillance. And if we could start with the next slide, please. And this was really timely when we started it, because for the first time at the COP meeting, and there was COP28 in Dubai, there was a health day, and climate change and health was discussed. So we really wanted to have some kind of scientific evidence to back up the statements and calls for action. So at a preliminary stage of our review, we issued a communique that was in time for COP28, and then we also continued working on assessing the likely effect of possible mitigations and adaptation measures, and of course identifying knowledge gaps and opportunities. So if we could go to the next slide. We focused on neglected tropical diseases. NOMA at the time was not included in the list. And here we kind of separated them into vector-borne neglected tropical diseases, ones that are not vector-borne. And just by the amount of vast body of literature on dengue and chikungunya, we kind of separated it in analysis. And then after we already started with our review, malaria was also added to it. So we considered malaria as well. If you can have the next slide. So kind of looking at how is climate change going to affect distribution and transmission and impact of neglected tropical diseases and malaria is a huge field. So by the very nature of the field, we had to include a very large range of studies in this review. So that's why it's a scoping review. So from studies on life cycle biology to ensure that all life stages of the vectors that are relevant for transmission are considered in this review, to laboratory experiments that are testing physiological limits of those life stages, of course, with climatic factors that are changing in mind. Here, another very important aspect is time series analysis. Of course, we need long-term data to analyze the trends that go beyond seasonality and weather, changing in weather patterns. So we really kind of need long-term data to capture these climate trends and disentangle them. And this is, I would like to stress, kind of this long-term data is one of the gaps that we also identified. And it really has this potential for further research, especially now to identify causal inference. What is actually causing the trends in disease data that we are seeing? Is it climate? Is it public health interventions? Is it improvements in socio-economic conditions? Another type of study that was really well presented is vector suitability maps. They are important for informing surveillance, film studies, interventions, and they're kind of built both on this kind of physiological limits of what we know about vectors from occurrence data, and from that we can kind of see develop theoretical distribution maps that can inform field studies and later on interventions. In any kind of future projections, or in any kind of situation where we have to compare different scenarios in future, modeling becomes key, right? So a very big part of our review focused on infectious disease modeling studies, just by the nature of the fact that we can model certain things and we can address them more easily by models. So these have really, there are a whole range of different modeling studies. Some are more theoretical, the other are more anchored in data. But they do allow us to kind of look at cost effectiveness analyses, disease transmission dynamics and how they're going to change, look at incorporating future climate projections and different climate scenarios and see how is that going to impact disease dynamics, distribution, and stuff like that. And of course, they are important in design of intervention and informing policies. So if we could go for next slide. And one of the things that we realized very, very early on is that integration of all of these approaches was necessary in order to tackle this question of how is climate change going to impact infectious disease dynamics, especially with neglected tropical diseases and malaria in mind. And this is where it really builds on all of that. So from very basic biology, from climate data, from vector suitability and vector occurrence data. So you have this building layer by layer, all this integration of approaches, and most complex studies and also the most reliable studies built on all of the previous evidence from laboratory studies, from field studies, from climate data, from time series infectious disease data. And in order to kind of identify hotspots, inform local interventions, and also inform surveillance and monitoring. And here, it was also very key that the quality of these studies often depends on the quality of data, the quality of field data, occurrence data, population data. And there was always an opportunity to improve that data. And we think that there is really a possibility for community involvement and citizen science monitoring to kind of bridge some of the gaps in data that we're seeing. Next slide, please. So in looking at how to review this vast area of literature and these very different types of studies, we tried to automate everything that we could. So from building up very good search strings that were informed by word frequency analysis and automated tools, from identifying like really high quality seed articles that we can actually use in the search engines to look at similar articles, from these kind of preliminary searches that we could refine and update, to using syntax translation tools that we can actually very easily find and translate our search terms into different search engines. And one of the challenges we very quickly realized is that we had over 40,000 papers to sift through. That's a really vast number, especially when you're kind of racing against the clock to meet COP28 deadline and other things. And here I have to say, we really relied again on automating approaches, whatever we could. And we used Covidence for screening our abstracts, which is an AI supporting screening process, because as you review the abstracts, you train the algorithm and it learns like what is the likelihood that you will accept a paper or reject a paper. So it does make sifting these abstracts much faster, but we still had to go through almost 8,000 abstracts to actually have a good algorithm that is trained, because, and this is mostly because we had so many different diseases to consider. We considered 20 different NTDs plus malaria, and we had all these different types of studies. But, well, you know, the tools, these automated tools were really, really helpful. But we still had to read over 1,000 papers fully. And we identified over 500 papers where we needed to extract the data. So it was still a very human enterprise, and we did have a lot of volunteers. It was amazing to see when we looked for volunteers, how many people volunteered their time to help us extract the data and sift through this. And I would especially like to thank Samson's group, because they did spend a lot of time in doing that. And so from these studies, 511 studies, we had certain conclusions that Sol will tell you about. Thank you. So Sam, do you want to introduce Sol?
Yes. Thank you so much, Dr. Petra. So yes, so Dr. Anton Solomon, or Solo, is a professor of infectious disease epidemiology, NDM Center for Global Health Research, Big Data Institute, University of Oxford. Sorry, I was going for Detri. So Dr. Anton Solo is the chief scientist to the Global Neglected Tropical Diseases Program at the World Health Organization. After 4 years living and working in Ghana and Tanzania, during which time he finished RSTMH PhD on trachoma, Anton Solomon completed specialist training in infectious diseases in London. So he'll talk to us about the results of the review. Solo, over to you, and sorry about that.
That's right. Thank you very much, Sam. Pleasure to be here. As Petra's noted, there were 42,000 publications that we screened with a combination of automated tools and hand reading. We found 511 in total that met the inclusion criteria. Jasmine, would you mind going to the next slide, please? Thank you very much. So 511 papers in total that were included. And of those 511, there were 185 that had malaria as at least one of their outcomes, and 181 that looked at dengue and chikungunya. So for each of those two groups, malaria and then dengue and chikungunya, there were more papers than for all the other NTDs combined. It's good that those diseases get attention. They're common, they're important, they can kill people. But 3 NTDs had only 1 paper each, and 5 NTDs at the bottom of that graph had no papers at all. So that's both not enough research and not enough coordination, I would say, amongst us as a group of researchers in looking at these things. Jasmine, next slide, please. When we look at the geographical coverage of the papers that were included, you can see that sometimes the focus was a little bit skewed. If you examine these panels carefully, you'll hopefully be able to see that none of the 9 papers on rabies considered India, which as a single country records more than 1/3 of all rabies deaths every year. None of the 8 papers on human African trypanosomiasis looked at any part of West Africa. The 2 papers on onchocerciasis were focused exclusively on a handful of countries in the Gulf of Guinea, and a single paper on soil-transmitted helminthiasis colors in Brazil on this country-level map, but in fact was about the ovices and parasites were identified in the sand of 7 beaches. So the overall conclusions that we can draw from this work are somewhat limited. It's really not possible at this stage to be definitive about the likely overall impact of climate change on either malaria or any of the NTDs, although there are some suggestions that, for example, the arboviruses will continue to expand if things go as we assume that they will. Jasmine, next slide, please. Thank you very much. We also dug in a bit and used this technique of locally estimated scatterplot smoothing to compare the number of papers that met our inclusion criteria, which is shown on the y-axis of these panels, with the Healthcare Access and Quality Index, where higher scores are linked to better health systems, and the number of papers meeting the inclusion criteria with the climate vulnerability score. And that one reflects a country's exposure to climate change, its sensitivity to climate change, and its ability to adapt to the effects, the negative impacts of climate change. For climate vulnerability, the lower scores are better. So you can see for malaria that there were more papers covering countries with worse healthcare systems and higher climate vulnerability. That seems appropriate. If you could click again, please. Thank you. The opposite is true for dengue and chikungunya. There were more papers covering countries with higher healthcare access and quality, and more papers for countries with lower climate vulnerability scores. That essentially means that research on the climate crisis in dengue has focused on risks for rich countries and not the countries where people are currently dying of dengue. So these are things that we felt need to be corrected in the future. Thanks a lot. I'll stop there.
Sam, you're
I think
muted.
you're muted.
Hello, can you hear me now?
Yes.
Yes, that's fine.
Thank you very much. Thank you so much, Anton. So I'd like to introduce Professor Deidre Hampson, Professor of Infectious Disease Epidemiology, NDM Center for Global Health Research, Big Data Institute, University of Oxford. She works on the development of mathematical, statistical, and computational models which inform disease dynamics and translation to global health policy. Deidre, over to you. And she'll be talking to us
Thank
on
you.
modern part.
Thank you very much, Sam, and thank you again to RSTMH for hosting us. So I'm going to talk through some of the discussion points which the panel who were involved in this project identified through the research. So if we could go to the next slide, thank you. So there's a few core gaps that we wanted to highlight. One is, of course, that one of the things that people are particularly interested in is elimination and emergence of diseases due to the changing climate. But both transmission models, but also epidemiological studies are rarely, have a good understanding of why diseases go extinct or why they re-emerge in particular areas. And so I think we need new thinking and different methods and analyses to try and understand those dynamics. There was also a discussion about the fact that while there were risk or distribution maps at quite high levels, for utility to support national programs, there needs to be much smaller scale understanding of different geographies at local areas to understand where vectors may be emerging or where vectors may be holding out between seasons, etc. And while some of the studies did use remote sensing data, and while there is a huge amount of data available, there could be much better use of it. And that really requires sort of an upskilling of the people working in this area, because that data is available in huge volumes, but it's quite difficult to engage with that data and use it in the right way for the setting that you want to study. We also highlighted that there were very few global data sets available. Sometimes on the continent, on a particular continent, there's fantastic open data, but there's very little global long-term data sets. We do feel that there's a lot of potential to use community involvement and citizen science to generate the evidence which is required to understand this. So, there's not going to be large-scale funding to do new studies, but maybe there are opportunities in key areas to use local involvement and even learn from local narratives about how transmission of these diseases have changed over time. And so given all of these uncertainties, the limited evidence, it's going to be difficult to support policy planning in the face of climate change, but it is going to be needed, and it's going to be needed now. So we really do need to work as a community to generate more evidence. I'm going to drill into a couple of these issues in the next couple of slides. Thank you. So one of the challenges is which scenarios people are using for future climate. And the International Panel on Climate Change not only produces scenarios in terms of the climate itself, but also a lot of other socioeconomic pathways. And I'm not going to go through this table in detail, and there is information in the paper. But it would be helpful when people are doing forward projections if they actually were able to engage with the details of these different definitions and what they mean. And again, that requires that translation piece between the experts in these data and the experts in the diseases that we're talking about. Thank you. Next slide. So there are some long-term data sets. This is particularly true for malaria and dengue. And less so for the rest of the NTDs. But there are new methodologies coming on board all the time, which try and use new methods of causal inference to disentangle the contribution of the public health interventions, the climate shifts, and the socioeconomic changes, so that we can understand what's happened in the past and project forward into the future. And there are some exciting opportunities there. And maybe with the right data and the right collaborations, there are opportunities to inform our understanding of these diseases. Thank you. The next slide. As a modeler, you're probably not surprised that I'm talking about data, but it was a question that came up a lot when we were reviewing these papers. What data sets are they using? And mainly they're using either a small data set that possibly the researchers themselves have gathered, like the one that Anthony mentioned in the previous section, or they're using large open data sets. And really the power of understanding patterns across large areas is going to come from these large open data sets. And so the authors were keen to support the generation and sort of facilitation of large open data sharing. Thank you. The next slide. And just to revisit that point about local capacity, citizen science, new technologies, you know, there are opportunities to generate data from year to year, from season to season. Right now, we don't have to wait for a large study to completely, you know, transform our global understanding. And small scale studies using new methodologies can transform our understanding. And so the authors wanted to make the point that there are things that can be done now. And I'm sure some of the attendees on this webinar will have some thoughts about that. Thank you. Next slide. So the headline results from the review are that changes to climate are leading to shifts in these diseases, both in terms of their range, but also their intensity. In particular, the evidence is available for lymphatic filariasis, dengue, and malaria vectors. The ways in which climate change may impact all other NTDs is not well understood due to a lack of evidence. But we hope there might be opportunities to strengthen that evidence base in the future. But the global message is in relation to NTDs and malaria, effective mitigation and related adaptation strategies for climate change need to be built on evidence, and that evidence is not yet there. So what we'd love to discuss on this call more is how do we build that evidence base at a local, national, international level. I think I'll wrap up there and hand back to you, Sam. Thank you. Oh, sorry, I forgot I had one more slide, my apologies. So also the authors wanted to put in some action points, calls to action within this research. So we need to adapt strategies. We need to think about how we need to adapt them now to preserve the gains that have been made in these diseases. We need to improve surveillance systems and the related intervention strategies to try and mitigate what might be coming as a consequence of climate change, both in the short and the longer term. We want to involve those communities who are in the last mile of these diseases so that they can develop that. They have a much better understanding of the changes around them in many ways. And then we need to integrate climate resilience into health systems. And some of the ways that we suggested to do that are by enhancing existing health infrastructure, by strengthening the research, but also trying to facilitate these cross-sector collaborations. These are very different disciplines which will have to work together to support this research. And also the displaced populations that are going to be a result of climate change are going to be critical changes to how these diseases are transmitted and need to be better understood. So in summary, we want to invest in research to develop strategies, especially in the low transmission areas, that's both for extinction and emergence, and leverage new technologies for community engagement and data collection so that we can really safeguard what has already been achieved for these diseases and make it future-proof. Thank you, Sam. I think that was my last slide. Thank you.
Thank you so much, Professor Detra. I appreciate that. So we'll now like to introduce Dr. Alistair Robb, who is the advisor to the director, advisor director of the WHO Global Malaria Program, 30 years of working across the world on health policy. He will be talking to us about the next steps for programs based on what we know. Alistair, over to you.
Great. Well, thank you very much, Samson, and thank you again to the organisers for inviting us to this important webinar. Next slide, please. So, for many years, we've known about the importance of climate on local ecology and health. Hippocrates identified, whoever wishes to investigate medicine properly should proceed thus. In the first place, to consider the seasons of the year, for they are not all alike. Then the winds, the hot and the cold, peculiar to each locality, and the ground, whether it be naked and deficient in water, or wooded and well watered. Vector-borne diseases and malaria are good examples of climate-sensitive diseases. Changes in temperature and humidity and rainfall will affect vectors and pathogens, potentially altering the intensity, geography, and seasonality of the disease. But climate factors can make it both more or less conducive for disease transmission. And there are many other factors that also impact on transmission, making it difficult to attribute changes in disease to climate and to predict the effects of climate change. Next slide, please. Human-induced climate change impacts human and planetary health. The Intergovernmental Panel on Climate Change identifies greenhouse gas emissions as a cause of increased frequency of extreme weather events. Whether it be heat waves, floods, tropical storms, these events impact on people's health. In addition to their direct effect on disease transmission, they can have a wider disruptive effect that negatively impacts on the effectiveness of the interventions, access to health services, people's livelihoods and food security, all of which make people more vulnerable to disease. And we've seen this recently in countries in Africa and in Pakistan. Long-term climate impacts also hamper disease control due to their effect on land use, conflict, migration, and livelihoods. Next slide, please. In the 2024 World Malaria Report, we identified various factors, biological, environmental, social, structural, and economic, that increase people's vulnerability to malaria. These factors often intersect, with individuals facing multiple factors that compound their risk of disease and its consequence. It's the same for NTD, and as this quote shows from the Lancet Countdown Report of 2023, these broader determinants increase people's vulnerability to the effects of climate change. So populations are more at risk of climate change and of the diseases that we focus on. Next slide, please. With this in mind, it's our collective duty to establish sustainable and equitable futures by mitigating climate change. And this is well articulated by the DG of WHO, who said, the continuing expansion of fossil fuels is a death sentence to millions. There's no excuse for persistent delay in climate action. Temperature rise must be limited to 1.5 degrees C to avert the worst of climate change, save millions of lives, and help protect the health of everyone on Earth. We are health ambassadors. We should also be climate ambassadors. Next slide, please. So it's very clear that from the conversation we've already had, the presentations we've had already, that effective mitigation and adaptation strategies for climate change need to be based on evidence to help raise awareness of the challenge and to support a more effective local response. Recent modelling by Boston Consulting Group in the Malaria Atlas Project is a good example of using climate modelling to raise awareness of the effects of extreme weather events, such as cyclones and malaria. But for local decision making, as been said, we need contextual data to understand the local effects of climate change and health risks. This calls for investment in integrated surveillance and intervention systems, covering multiple diseases and taking a multi-sectoral approach, as seen in Nigeria and Senegal. Bringing together data on climate, vectors, and disease can help define how to adapt to the immediate, short, and long-term effects of climate change. And quality of data will also need to be complicated by local research and the engagement of communities of valuable local experiential knowledge. Next slide, please. So WHO has been supporting countries for many years to build climate resilient and sustainable health systems. I want to concentrate on the first two areas of this, areas of support, the assessing health risks and the climate change and health planning. Assessing health risks helps to identify the vulnerability of people to climate-related health threats. But it also helps understand the negative impacts on delivery systems. This then helps plan for services and interventions that are available, accessible, acceptable, and of good quality in the event of different climate scenarios. The disease elements that we are interested in need to be bedded within this wider sector planning and they need to be captured in national adaptation plans and at least in national health adaptation plans. Next slide, please. So as WHO, we've had a big demand from countries and partners for more guidance and planning on malaria and NTD response to climate change. And in response, we want to virtually convene experts, ecologists, climatologists, disease experts, health system and data experts, modelers, civil society, and policymakers to consider what we already know from a historical and current data perspective, what research we have, and country experiences. Can't highlight enough the importance of country experience, as a scoping study revealed that there are few studies on adaptation. So we're keen to hear from any of you about your experience, and we'll use that to plug in to our discussion. The process will also help us define how best to use data and the different use cases. And finally, as it's already been said, research is of critical importance. We're keen to see more investment in local research. And I just want to ask someone from the Royal Society to highlight some of the opportunities for funding on research. Thank you.
Thanks, Alistair. And if I could get the next slide. This is such an interesting study, and I'm sure you've heard lots of that today. So Anthony mentioned in his talk that there are some gaps, some obvious gaps. 5 of the NTDs were not covered. Deirdre mentioned that studies at local level, local area level are really important. And as Alistair mentioned, we need to have a range of disciplines and approaches looking at this issue. So I just wanted to highlight, I mentioned before that we have a grants program. We support those who have not had research funding in their before in their own name, so early career researchers, to conduct a 1-year study. They receive up to £5,000. Now we've given out over 1,000 of these over the last 7 years, mostly to LMICs, based researchers, half to women, which we're particularly proud of. You can be based anywhere in the world and be looking at any type of project. We asked the panelists today if you were to try and encourage early career researchers to utilise our grants programme and to try and further some of the gaps that we've seen from the results of this study, what would you ask them? So these are here just listed some of the types of studies that you could do to help this area of work. So landscaping exercises, identifying opportunities, thinking about how we can build open platforms of data for modelling. And also, just at the last point, number 4, these 5 NTDs specifically, studies in those areas looking at climate change would be really important and really welcome. And we know that these are gaps in our knowledge which could really help us in the future. So that's all I wanted to say. Sign up to the newsletter if you want to find out about the grants programme. And if this isn't reflecting your stage of career, please do pass information on the back of this webinar for people to start to think about projects that could be helpful to this space. Thank you, Alistair. Back to Sam.
Thank you very much. I appreciate that. So I appreciate all the speakers for your wonderful presentation. It's now time for Q&A. So we have about 14 minutes so that we can go into questions. And so I would appreciate if you can select some of the questions in the Q&A chat. But maybe before you do that, I have a question for you. If you can briefly just talk about the quality of the studies that were included in this scoping review.
Sure. I think I could say 2 things about that. One is that it was very clear that the geographical range of the coverage of projected data was inadequate. That was shown in that snapshot with all of the map panels. And then the second thing to say is that because of this relatively small number of papers that were available per disease, we didn't really carry out a formal quality assessment. So many of the studies that were included were methodologically imperfect, shall we say. There's a lot still that we have yet to learn about this field of work.
Right. So do you mind helping pick up a question or 2 from? You're muted.
Of course. Thank you. So there was a question that perhaps either Petra or Deirdre could take, was about asking about the ideal time span to obtain climate change data. That seems like a good one to start with.
Right.
I can
Petra,
start,
do you
and
want to
Deirdre, you
take
can
that, or
maybe follow
Deirdre?
up on that. It's really key
Please.
to have really data on decadal scale. So several decades of data if you want to disentangle climate trends. Because, I mean, as we know, seasonality of infectious diseases varies. Sometimes interannual changes can be very different. But if we want to capture really climate trends, we need to go beyond like the natural cycles, even of El Nino, La Nina, Mid-Atlantic Ocean synchronization, so oscillation. So we really need to capture several decades of data in order to be able to disentangle the climate trend in there. And Deirdre, over to you.
Yeah, absolutely. And the challenge is that for many of these diseases, we simply don't have that data, right? So then how are we going to try and build an evidence base of what might be happening in the future? And so that's why seasonal data is at least tells us something, even if it doesn't tell us everything. And so, you know, if we can capture some of the variation in transmission dynamics, vector dynamics on smaller timescales, that's really all we can do for some of these diseases. And it's really so variable by disease. So, for example, you know, floods are changing the distribution of visceral leishmaniasis in East Africa. You know, there are opportunities to learn from those things happening, and that's the best we're going to be able to do at the moment. So I think it's not perfect, but we can still learn something even if we don't have those decadal information. But as Petra was highlighting, there is decadal information from other fields and from other sources that we could try and pull in a bit to help us in terms of the changing dynamics of people's health generally.
Thank you both. And then Sam, perhaps we could ask Alistair to respond to the question that goes, has it been scientifically proven that climate change influences malaria disease transmission? You'll need to unmute though, Alistair, please.
Yep, I'm trying to unmute. I'm struggling, but I've succeeded. I think it does influence malaria. It influences malaria through the way that it impacts on the vector, as I said, not always in a way that's going to increase malaria. In certain circumstances, it will decrease malaria. I think what we also need to be very cognizant of is, in addition to that direct effect on malaria transmission, it will impact on the way that people can access services, on their livelihoods, their nutrition, all of which then impact on disease. So it's still there's no linear nature to this. It's a complex weave of different factors that then impact on disease. The challenge we're going to have is, how do we support countries look at their individual context, both the context and how that then the effects of climate change affect that local context ability to increase or decrease transmission, but also the effects on the health system and the effects on some of these wider determinants.
Right. So maybe as you're looking for more questions, I have a question for Dr. Berry on, you know, what is Reaching the Last Mile doing to support funding for health impact on climate? If you can talk a little bit about that.
Thank you very much for that question. And before I answer it, just to say it was really interesting listening to the presentation of the details of this report again and understanding the challenge ahead of us. And as you know, Reaching the Last Mile and the government of the UAE have been very committed to the climate change and health agenda. As was mentioned, the COP in Dubai was the first one that actually dedicated focus on this area. So following on from that, RLM has published a paper together with the Rockefeller Foundation and Foundation S, looking at financing, global finances for financing for climate and health, as in trying to better understand what resources are actually going to support what the call to action that we've just heard here. So this paper was just published in Davos just a few days ago as a baseline, so we can actually understand where we are. The good news is that the amount of funding going towards climate and health, health action in response to climate change has increased. It's about just over 7 billion, increasing from 1 billion, the last estimates in about 7 years ago. So this is good news. However, the worrying concern, and also repeating the pattern that was described from the data of actually what is going on, is that a significant proportion of that funding, that additional funding, almost all of that additional funding is actually spent in higher income countries and less in the most vulnerable low-income countries. So that is a big concern. We also acknowledge that even in those countries that are disproportionately affected by climate change impact, they're actually spending a lot of the funding that is available to them is in the way of loans as opposed to grants. So this in itself complicates and increases the burden of the burden on those countries, and their ability to actually respond and improve their health systems is challenged by the fact that the funding that is available is more of loans that they have to then repay, often with interest rates, than outright grants. So So what is RLM doing? RLM believes very strongly that philanthropy has the opportunity to act as a catalyst for investment, to actually open up the conversation, lead the way in actually investing in those things that more traditional resources may not be able to fund. So like funding research, such as we've just been hearing about today, the funding some of the gaps, the response to the gaps that have been articulated today is the sort of thing that we believe that philanthropists might be able to do, because they can move with the agility that more established structures may be challenged with. We believe that we need to also focus some more of this climate and health funding to those most vulnerable low and middle income countries. We need to make it easier to access this funding, make the funding more transparent, and make sure that that funding aligns with the national priorities in the country. We don't want to create another set of vertical programs. We want the climate research or climate mitigation funding to build up the broader health system, to be part of building resilience in the health system. We're strongly advocating for grants rather than loans, because we think that in the long term, that actually is more likely to lead to resilient health systems that we want to see, that can respond to the climate challenge. So those are some of the things that RLM is doing at the moment.
Thank you so much. I appreciate that. So there's another question on the Q&A, which is also of great interest to me as well, on integrating these different programs. So someone would like to know, how can we use malaria program to address NTDs in the future? What evidence is needed in this area? So I don't know if any of you want to take that. Anyone?
After you, Alistair.
Solo? Oh, Alistair? You're muted again.
Sorry, I was actually going to make a broader set of comments, because I looked at the questions in the chat, and I will come to integration within my response. And I think what's really clear is that there is a real need at this point in time to ensure that we achieve impact in these diseases, because that's where the prize lies. There's a prize associated with tackling these diseases that penalize the poorest and the most vulnerable populations. And therefore, it's also about recognizing the human and economic cost of inaction. And so we need to think, in a time of economic shortage, how do we then get the most from the limited resources we've got? And to a certain extent, we've covered some of that today. We've covered it by actually talking about the real importance of data to drive the response. In malaria, we're actually not throwing the kitchen sink at the problem. We're supporting countries identify the right mix of interventions. But at the same time, there are some great gains to be had from integration. All of these vertical approaches don't stack up to as much as when you then integrate programs. And many of the disease programs in Africa now aren't just malaria programs, they're malaria and vector-borne disease programs. So there's a start in terms of the way that programming is developed. But it's also important to recognise the value of primary healthcare. And primary healthcare as a means of doing three things, all of which have been discussed today. One is about the integrated delivery of services close to where people live and work. The other is about community engagement. Community engagement is a critical element of how we will be more effective, equitable, and sustainable in our response. And communities have experience and knowledge that can help identify who's missing out, whether it be missing out from malaria or any other interventions, and look at some of the ways to overcome those barriers. Primary healthcare also helps address the broader determinants of disease, such as climate. So I think it's going to be really critical into the future with limited resources that we see integration not just as an end in itself, but as a way of actually improving the effective use of the limited resources we have. I just want to say one last thing, which is another question that was in the chat, which talks about the way that the global financing is actually continuing to restrict financing. The important thing is that there is now a clear move to change the way that global finance currently works. The Lusaka agenda is a call for that global finance should be aligned with the priorities as set by countries. Let's see how far that goes, because that I think is going to be critical.
Thank you so much, Elsa. I know we're running out of time. So I'll give each speaker less than 30 seconds for your closing remarks, please. So Petra, we'll start with you.
Yeah, thank you. Well, thank you everybody for your participation and contributions in this webinar. I guess the only thing that I want to stress is that, as a modeler, I can say that, models are only as good as the data that we have. And I really want to stress the importance of data sharing and making long-term data publicly available, if there is that, so that we can really reanalyze some of the data sets with novel methodology and disentangle contributions of public health interventions, contributions of climate change trends on disease dynamics. Because, as we saw in the chat, it's not always that climate change is going to make things worse in certain areas, like climate change is going to make certain areas uninhabitable for certain vectors, which will, help certain areas eliminate neglected tropical diseases. But, what we really see is this shift in distribution of vectors, shift in where people are, shift where these might be hotspots, the shift of the hotspots in the future. And having data, good quality data, helps us untangle these things. Thank you.
Thank you very much. Professor Dedra.
Thank you. Yeah, some really interesting questions in the chat and lots of people who obviously want to get engaged in this question. So I think thinking about how small scale studies can be coordinated in a way that informs the global picture, I think will be a critical next step. And you're delighted to hear that funding is trying to support those efforts. And it's got to be this multidisciplinary approach. We've got to have people from different disciplines supporting what actually are the questions that the national programmes have and the global programmes for some of these diseases. So I'll finish there. Thank you very much.
Thank you so much. Dr. Ebre?
I want to end on a positive note to again mention that today Niger is the first country in the Africa region to have declared elimination of onchocerciasis. And so it's good news. Even though we've talked about the challenges in understanding the burden of disease and the trends and the patterns, we also need to acknowledge that elimination is possible, so we can encourage other countries, other communities, other teams involved in this space to continue to work on this agenda. It is possible. So congratulations to the communities, the government, and the NGOs, the research teams that have led to this good news today.
Thank you so much. Solo?
Thanks, Sam. Three quick notes of thanks. One is to all of the people who contributed to the scoping review. There were a lot of them. We couldn't have done it without all of that input. Second, to the funders who funded it, Reaching the Last Mile, Fred Hollis Foundation, Gates Foundation, and the European Commission, really essential contribution from that side. And thirdly, to the Royal Society of Tropical Medicine and Hygiene, and to all of you for contributing today. It's been really good.
Thank you so much. Alistair, anything else?
I'll be very quick. Keep the eye on the prize, focus on sustainable and equitable futures, which includes achieving a malaria and an NTD-free world. And that data will help accelerate progress, but will also help us address some of the threats that we will encounter.
Thank you. And thank you to all speakers. I really appreciate that. And I want to invite Tamara for closing the webinar. Tamara, over to you.
Thank you so much. And a huge thank you to Sam. Thanks for chairing this session. And thank you to Alistair, Anthony, Deirdre and Petra for being speakers today. And just to echo Anthony's point to all of the authors that were involved in this enormous study, we're really grateful. And as we've mentioned and we've heard, there's a lot more work to do in this area. So if you would like to be involved in looking at the grants program that I mentioned, the very low level grants, early career researchers, do sign up to the newsletter. The 2025 program will be opening very soon. And if you would like to consider joining RSTMH, there is a special offer of a longer period of time than the 12 months just for World NTD. So the link will be in the chat. You'll be able to see that. And the abstract for the paper will come to you as part of the follow-up to today. So all that's left for me to say is thank you so much to everyone again. Thank you to all of you for joining and being part of this webinar. And thank you to WHO again for bringing the opportunity to us and to our partners for NTDs, including Site Savers Unlimit Health, UK Coalition Against NTDs and Uniting to Combat. This is a great community around the NTD space, really trying hard to make a difference, and we're really pleased to be part of that journey. So thank you all for attending today, and we hope to see you all soon. Thank you. Goodbye.